Morning. Reaching out to Markie G, Damian Crawford, and Dayton Campbell. Blessings to each and every one of you. I reach out this morning because it's very concerning. My mother got discharged from. My mother is a retired teacher, a retired educator, and I carried her to Lindsay Hospital for because she could not walk properly and she couldn't hold her bladder, right? And she's just 57 years of age. So because like she can't see out of one of her eyes, so she had to get early retirement, right? She ended up went blind, out of one eyes, partially blind. So so as I said, I carried her to Lincoln Hospital to get the surgery, to get them check up on her, right? So I carried to Linton, to have them find out what is going on, because it's concerning to me how my mommy is just not moving as how she should. After carrying mommy there, they did an MRI on my mother. They sent us to do an MRI, carried mommy to do it. Waited on the result, carried back my mommy and the result. They admitted they admitted mommy there. They contacted the Kingston Public Hospital because they don't have a neurosurgeon there. So they contacted the Kingston Public Hospital. Kingston Public, they told them that they had to get a CT scan done to confirm the MRI result. They carried my mommy in the ambulance, get the CT scan done, carried back my mommy to to Lindsay Hospital. Then after getting the CT scan done on my mother's brain, they carried back my mother and said that my mommy would have to go to the Kingston Public Hospital to see the neurosurgeon. So I asked them if mommy is going to travel by ambulance, right? Because I don't have a personal vehicle. They said no, the ambulance are unavailable, which I'm looking at the ambulance on the compound, and they're saying that I would have to carry mommy to the Kingston Public Hospital, appearing to by public transportation. So what happened? I carried mommy. So they said that they were going to discharge mommy. So they discharged mommy on the Wednesday, right? And said that the appointment to see the neurosurgeon would be on the Thursday, the following day. So my mother asked them, because we live in Clarendon, right? So my mother asked them if she could just sleep there for the Wednesday night, so the Thursday morning we could make it to Kingston Public Hospital early, right? To see the neurosurgeon, because they explained to us that it's a ticking time bomb. It's a brain aneurysm. It's a swollen blood vessel that is in my mother's brain, that they say if her blood pressure should go up, it can burst and it can bleed out and she can die. So what happened is that mommy asked them if she could sleep there. They agreed for mommy sleeping there the Wednesday night. No, the Thursday morning. No, the Thursday morning. I went to collect my mother from the Linstead Hospital and bring her to the Kingston Public Hospital, right? After arriving at the Kingston Public Hospital, I saw that I saw the neurosurgeon, right? Seeing the neurosurgeon, uh, when I looked in her hand, I saw that the IV device was still in my mother's hand. So that was shocking to me. So I went to the Kingston Public. So I spoke with the neurosurgeon. After speaking, so I spoke with the neurosurgeon. I bring mommy straight to the neurosurgeon because, they said that is an emergency. So I carried mommy to the neurosurgeon. When they spoke to the neurosurgeon is letting me know that I gave him the referral and everything. He's letting me know that he cannot do the surgery. They cannot do the surgery. And reason being, they don't have the equipment for them to do the surgery. And that is that is concerning, because health is priority. They tell us that health is priority. Health comes first, right? And if the hospitals are lacking the equipment and lacking the proper trained doctors and nurses. That means when persons go to get care, they're just going to die. And this is sad because apparently they left my mommy to die, right? And to know that my mommy is a retired educator and be treated like this, it is really sad. It is really sad. And this is the reason why I choose to vote. Because I'm 30 years of age. I've never voted before. Never voted before. But this I have to stand up and vote because this is corruption. This is sad. My mommy is a retired teacher. There's no way a retired educator, a government worker, should be treated this way, right? Because what the neurosurgeon did at the Kingston Public Hospital, they gave us another referral to go to the UC hospital and telling us that we have to pay over $2 million to get the surgery done on my mother's brain. And we do not have it. We do not have it. And right now, my mom is still having get the surgery done. My mom still has the aneurysm in her brain and it's still ticking, apparently, as what the Linstead Hospital says. So I'm just asking you all, please, to assist me. I'm seeking some assistance in this matter, please. And also please to improve the hospitals because the hospitals, you're Markie G, and you see that the entire Jamaica is saying you, Markie G. We're fed up. It's been too much. It's been too much. We've been suffering and like, yo, it's. I'm asking you, please, as our next Prime Minister, Mr. Golden, I'm asking you to please make the hospitals be a priority because we have the worst healthcare system here in the Caribbean. And this is sad. I feel like this is the worst healthcare system because there's countless persons crying. There's countless persons dying. So I'm asking you, please, to when you're going, as our next Prime Minister, please to ensure that the hospitals are a priority. Please to ensure that they are fully equipped. Please, Mr. Golden. And I'm asking you all, so Markie J, I'm asking you, please, as our next Prime Minister, can you please render me some assistance and help in this situation because I do not want to lose my mother. I swear, I do not want to lose my mother. And this is sad to know that a retired educator is treated like this in our own country that she served. And remember that accidents can happen where it doesn't matter. You could be the middle class, upper class, or lower class. You meet in an accident and have to be rushed to the hospitals to get immediate assistance. And if the hospitals are not improved, are fully equipped, that means to say that that person that need that immediate assistance will not get it and be left to die. So I'm asking you, please, to make the hospitals a priority, please, because this is sad. And one Markie, man, one Markie, Damian Crawford, and Dayton Campbell, blessings to you. And God appoint to them, man. Yeah, man. God say full time now. His people has been suffering for too long. It's been for too long now. God appoint leaders and him take them down. You see me? Yeah, man. And Mr. Same appoints you, Mr. Golden. As I see that God appoints you, Markie G, as our next Prime Minister. Yes, it's evident that God appoints you for our next Prime Minister to liberate you from these things that we are going through. So, blessings and big love to you and everyone in the PNP camp. Big love.